A surgeon might spend 8 hours in the operating room saving a life, only to spend the next 2 hours wrestling with paperwork. Doctors manage patients by stitching together a patchwork of disconnected tools, checking calendars for schedules, WhatsApp for updates, Apple Notes for details, and Excel for billing. Copying data manually causes friction, and sometimes critical patient details slip through the cracks. These corporate software tools were designed for traditional office workers sitting at a desk all day. They were never engineered for the high-stakes, mobile reality of clinical medicine. By forcing highly trained specialists to act as their own IT support and ad hoc system administrators, we are directly eating into the hours they could be spending actually treating patients. The logistical challenge only compounds when a physician operates across multiple facilities. A single Tuesday might involve morning rounds at a city hospital, afternoon outpatient consultations at a private clinic, and an evening surgery at a third location. To fix this, the entire workflow needs to live in one place. DocLogbook serves as a centralized command center specifically engineered to handle the complete life cycle of a medical practice. Looking at this unified calendar matrix, the setup phase becomes simple. Instead of juggling separate diaries, a doctor can schedule outpatient departments and surgical blocks across every hospital they visit, all visible within one master timeline. With the logistics mapped out, the physician can step away from the screen and focus entirely on the procedure at hand. The moment the operation is finished, the platform's clinical logbook activates. This interface allows a surgeon to upload imaging files, add procedural codes, and type out specific surgical notes directly into the patient's record while the details are still fresh. Connecting this clinical data directly to the scheduling block immediately after the procedure closes the loop. It eliminates that end-of-day memory gap, where doctors are forced to reconstruct their surgical notes hours after the fact. But a completed surgery is only half the life cycle. The practice now has to navigate the business reality of getting compensated for that work. Tracking revenue across 3 or 4 different hospital billing departments requires dedicated pipeline management. Otherwise, a completed case doesn't always guarantee a paid case. This financial pipeline visualizes the finance dashboard, which tracks the initial billed amounts for every single logged procedure. If a hospital delays processing, the system isolates those delayed invoices, ensuring that pending payments remain highly visible instead of getting buried in a spreadsheet. Once the funds finally clear, the doctor can easily reconcile the received payments, officially closing the loop on that specific patient encounter. By tying the clinical log directly to the financial pipeline, what used to be a chaotic billing scramble becomes a secure, predictable revenue stream that protects the practice's bottom line. When a doctor repeats this clean process daily, something interesting happens over the long term. Zoom out from a single week and look at a year or even a decade of practice. A single daily log multiplies over time, building a massive, mathematically precise database of an entire career. The analytics dashboard instantly translates this raw data into comparative bar charts and growth lines, revealing actionable insights into practice growth, seasonal volumes, and clinical trends. All of this historical data also feeds directly into a CV builder, automatically generating a comprehensive professional resume, backed entirely by verified chronological case logs, secured by strict medical-grade privacy protocols, trusted by physicians globally, and completely free to use. By offloading the constant micro-logistics of scheduling, logging, and financial tracking to a unified system, DocLogbook finally frees doctors to focus entirely on their ultimate goals, caring for patients and growing their practice. Start your journey today. Download at DocLogbook.com.